Hi, y'all. I'm Jen Laws, and this is your second quarter 2023 HIV-HCV Co-Infection Watch report. Last week, the Centers for Disease Control and Prevention released 2021 sexually transmitted infection data focused on gonorrhea, chlamydia, and primary and secondary syphilis. While all STIs continue to rise, now for the eighth year in a row, primary and secondary syphilis rose by about 32% in 2021. This is particularly alarming as other data suggests this rise in syphilis is having a disproportionate effect for pregnant people and people who may become pregnant, particularly among Black, Hispanic, and Latino populations. Congenital syphilis comes with numerous problems, including a 40% likelihood of stillbirth and other complications like blindness, developmental disabilities, and malformed bones for newborns. In 2021, President Biden promised the American Rescue Plan would allocate funding for public health workers to combat the rising tide of STIs and help prepare for any future pandemics. However, states have been slow to act on these dollars, with many sitting on a small stockpile of unused ARP funds or having reallocated those dollars for other uses. And even with last year's surveillance report foreshadowing this year's, certain senators suggested they didn't believe there was a pressing need for additional funding to support these types of public health programs, particularly citing COVID era funds as to why these programs should not receive additional dollars. Our friends over at the National Coalition of STD Directors continue to urge an increase in funding for these critically necessary programs and positions as the workforce behind HIV, STI, and HCV education, prevention, screening, linkage to care, and treatment remain stretched painfully thin. There's your focus for now. Love y'all.